Hello students, Instructor Pamela here, and welcome to an overview of coding and billing. And then it comes to your job as you continue to proceed through your healthcare education and career. First, understand that coding and billing can be the same position, or as a healthcare professional, you'll be performing those two functions. And that's mostly at a physician office. Why? Because most of the physicians create their encounter form that has all of their services and their ICD-9 codes that they work with on a daily basis. They check those off when the patient comes in. The payer/coder looks at the information or on the chart to determine if the physician did the appropriate assessment, and then we're able to bill it. So the most important thing that you want to ask yourself as far as a biller or coder, who am I working for? Because who you're working for is going to determine what claim form you're going to use. 9 times out of the 10, if you're not an inpatient hospital coder or an inpatient facility coder, such as a skilled nursing facility or any facility that's 24 hours or more, you will be considered an outpatient coder. And with that outpatient coder, you will be utilizing your CMS 1500 claim form to actually submit all of your codes, your CPT codes, any HCPCS codes that you can apply, as well as your ICD-9 codes for billing. Now, an inpatient coding has a different set of guidelines, and inpatient billing is submitted on a weekly basis, let's say, or every 3-day basis, whenever there are enough charges to submit for laboratory, for radiology, or for surgery, or for whatever it is, they're actually billing. There's 2 different separate types of billing in inpatient coding. They call it hard billing or coding, or soft coding or billing. And when it's soft, that means we're actually inputting the data, you as the coder or the biller. If it's hard, that means that there was a code that's already connected to a revenue code that's going to apply it right over to the claim form to where you don't have to do anything else. So keep in mind that even though that school may seem a little overwhelming with all of the information that you're actually learning, when you go to your job, it's going to be very streamlined. You're going to know what codes you need to assign for each diagnosis that's the same. You're going to know what procedure or surgery to a code for the same surgery on the same day across the board. For example, when I worked at the multi-specialty surgery center in Las Vegas, Nevada, we did all surgeries across the board. So when, let's say, Dr. DeBrod came in on Tuesdays and did 30 cataract surgeries on 30 patients, 30 surgeries, 30 cataracts, that sounds a lot, but it takes about 5 minutes for the physician to perform that surgery. So I'm able to apply that same code and that same ICD-9 code over and over again. The only thing that changes, either it's the left eye or the right eye. That's it. So again, just take your time and breathe and understand that you're learning everything across the board, but when you go to your jobs, it's going to be very specific. Same thing with your coding. You have edits. Everything that goes into the computer program with data entry is going to be checked somehow, some way. If you made an error, it's going to let you know. It will say, please, you put a male and the patient's name is Fernanda and not Fernando. If you didn't decipher that and you put a male, your computer program will go ahead and I'll let you know that it was incorrect. So this is some information more on coding and billing and how it works when you're inputting the data into the computer software program, whether if it's an EMR or EHR or whatever other program it may be. Just always understand your data entry skills with being precise is your main objective and your goal. Till next time, Instructor Pamela here. Thank you for listening and journey well. Bye-bye.